Welcome to Medication Administration Training, Module 4. We will begin this module by taking a look at the 4 potential problems when administering medications. Number 1 is refusal of medication. Number 2, allergic reactions. Number 3, difficulty swallowing or gagging. And 4, medication errors. If you are unsure about any aspect of medication administration, stop the procedure and check with a pharmacy or healthcare provider.
Number 1. Refusal of medication. What if a resident refuses? The resident has the right to refuse medications. Follow resident-specific protocols for medication refusals. Try to determine why they are refusing to take the medication. If a resident is confused, gentle persuasion may help, or wait a little while and try again. Contact pharmacy if there's any delay in administering medications. Follow instructions of pharmacist. If a second staff was able to administer the medications that were originally refused, then the staff who administered would initial and circle the initials on the MAR. The staff who administered and the staff who prepared the medications would sign the back of the MAR, indicating that they were both involved in the medication administration. If a resident continues to refuse the medication, complete an incident report and medication incident report. Documentation of a refusal continued. If a resident refuses a medication, sign your initials to the designated spot and circle your initial. Write in an appropriate code for a refusal as per the MAR. For every medication refusal, a medication incident report should be written, as well as a behavioral incident report, in case BMS follow-up is required. Documentation of each refusal is essential, as this may require further follow-up and require a resident-specific protocol for medication refusals.
Here is an example of how to document a medication refusal on a MAR sheet. The person has initialed in the time slot, however, has circled their initials. This indicates the medication was administered differently than expected. There is also a code number indicated as outlined by the legend on the bottom of the pharmacy MARs. When a time slot is circled, this is a signal to staff completing the medication administration to review the notes on the back of the MAR. This will give details about when and how the medication was administered.
Allergic reactions. Allergic reactions to medications may give a resident unpleasant or sometimes dangerous side effects. Signs and symptoms of mild allergic reactions are red, itchy, watery eyes, skin rash, blisters or hives, itchy skin. These signs must not be ignored. Do not give medications. Seek medical advice immediately and never ignore any reaction. Anaphylaxis is a severe allergic reaction. It can cause death. Immediate action must be taken to alleviate symptoms. Signs and symptoms may include wheezing, nausea and vomiting, weakness or hoarseness or tight throat, confusion, impending doom, swelling, catatonic, turning blue, unconsciousness, coma, and death may follow. Anaphylaxis can progress so rapidly that there may not be very much time to seek help. Do not ignore. Call for help and give assistance immediately.
Emergency medications. Examples include EpiPen for allergies or anti-seizure medications. A support staff must know the following: the resident's medical needs, what the resident reacts to, and the emergency measures to take in the event there is an episode. If staff are required to give emergency medications, specific training and/or delegation by an appropriate healthcare professional will be provided.
Lastly, the fourth potential problem when administering medications is medication errors. There are two types of medication errors: administration errors and documentation errors. Medication errors must be reported immediately via a medication incident report.
Administration errors. Examples of medication administration errors include missed medication, dropped medication, administering at the wrong time, a double dose, administering to the wrong resident. If a medication administration error occurs, call the pharmacy immediately. Healthline 811 after hours. Document the pharmacy instructions. Follow through on directives. Monitor the resident and seek further medical attention if required. Complete a medication incident report. An email notification will be sent immediately to the RM. Important reminder, even the most diligent staff may make administration errors. However, reporting an incident and following up to ensure resident safety is of the most importance following any error. It is staff's responsibility to report any errors as soon as they become aware of them, then follow up accordingly. Documentation errors. If a medication documentation error occurs, such as staff forgetting to sign, incorrect documentation, error in the MAR sheets, staff are to follow up with the missed signature to see if the medication was administered. Circle the error and write details on the back of the MAR explaining what happened, and complete a medication incident report. Examples of documentation errors continued. Not dating, timing, and signing entries where applicable. 2. Writing sloppily or illegibly. Writing sloppily can result in confusion and communication problems that at best can lead to inefficiencies and at worst could cost residents their lives. 3. Using inappropriate abbreviations. Avoid using abbreviations that can be misinterpreted and result in confusion and errors. Always refer to the legend on the bottom of your mark sheet. Accepting incomprehensible orders. Never accept questionable or incomprehensible orders. 5. Entering information wrong. 6. Adding late entries. A medication incident report is to be submitted for any of the following: unordered medication given, wrong dosage, unaccounted medication, wrong day and or time, refusal, omission, inaccurate administration of medication, failure to record correctly, unauthorized discontinuation of medication, and if it's contaminated. In addition to a medication incident report, submitting an incident report is also required if a behavior resulted from a medication error. Importance of reporting all medication errors. To ensure all potential safety gaps are reviewed and processes updated when or where needed, as well to ensure medication administration errors do not occur because of documentation errors. Note the example MAR sheet on how to document medication errors. On December 3rd, the designated spot for 10 p.m. medications is circled with no initials. On December 5th at 10 a.m. there are initials circled. Each have a corresponding code. Both circled areas indicate there were medication errors and is a signal to staff to see details on the back of the MAR sheets. Here is an example of how error notes are documented on the back of the MAR sheet. It is important to note that this documentation is factual and concise information, and reference is made to where additional information can be found. Medication storage and disposal. Store all medications in a locked cabinet. Always read instructions for how to store the medications. All medications are kept in a container as supplied by the pharmacist and stored as instructed by the pharmacist. Medications are stored in a locked area and keys remain in the possession of authorized staff. Obtain medical sharps container or make a puncture-proof sharps container with a small necked bottle for needles and syringes. Dispose containers when 3/4 full, secure with duct tape. Store in safe place. If unsure how to dispose, check with pharmacy. Medication expiry dates are checked minimally every 3 months. Expiry dates should also be checked each time medications are administered. Outdated, discolored, expired medications, refused medications, or any other medications that have been discontinued are to be stored in the medication cabinet in a vial container clearly marked as discarded medications. Any discarded medications are to be sent back to the pharmacy as per house-specific disposal policy as soon as possible. Discontinued medications. Medications can only be discontinued after receiving written confirmation from a medical professional. When discontinuing a medication, draw a line through the remaining days on the MAR and write the date of discontinuation. Note example MAR sheet on discontinued medication. Zopiclone was discontinued on December 4th. The person receiving the medication change form for the discontinuation has drawn a line through the remaining days of the month, as well have written the date of the discontinuation on the line. This will ensure incoming staff will be sure to know the medication is no longer to be administered to the resident. Temporary medications. If a medication is ordered for a short period of time, for example, 1 week of antibiotics, write the time and date of the last dose under the medication order. Draw a line through the remaining days of the month when the medication is finished. This should be done as soon as the medication is started. It is a good practice to write below the medication what it does so you can better monitor your resident for adverse side effects. If a resident is on Zopiclone, write below it in brackets, sleeping pill. Please see next slide for MAR example. Please see sample MAR of documentation of a temporary medication, amoxicillin 500 milligrams. Take 1 cap 3 times daily for 10 days. Admin times are outlined as follows: 8 a.m., 4 p.m., and 10 p.m. Note it has been identified on the MAR as a temporary med as well as what the medication is for. Example, antibiotic. Start date for this medication is December 7th at 10 p.m. and the end date is December 17th at 4 p.m. Note it is important to ensure you have a MAR sheet from the pharmacy prior to starting any temporary medication. It is only in the event you are not able to receive a MAR prior to administering that staff would be required to write up a temporary medication on a blank pharmacy MAR sheet as the sample shows. This would need to be done prior to administering any temporary medication. Ensure to count all days thoroughly and the amount of pills to ensure accurate amount of days are outlined on the MAR. Medication intake. When blister packs arrive from the pharmacy, all medications in the blister packs need to be reviewed by the staff to ensure there are no errors in the medications. The 7 R's are to be completed and the total number of each pill in the blister pack is to be documented on the medication intake form prior to a blister pack being used. Ensure next refill date is identified on the form. If the date is coming up, leave a note for the day staff to arrange a prescription refill. Please see sample med intake form. Here is an example of a medication intake form. When medications arrive to the location, staff are to use the 7 R's to ensure all medications are in the blister packs as per the labels on the blister packs, and also ensure this matches the labels on the MAR sheets. On each label of the blister pack, it will indicate the number of pills in the pack. For example, risperidone 3 mg would have 14 tabs on its label. If there are any errors, blister packs must be sent back to the pharmacy to be corrected. Therefore, intake will need to be done as soon as possible. Please note on this documentation, the name of the drug is risperidone 3 mg and the dose is 1 tab. Frequency is twice a day. It is also good practice to count the number of pills in each well of the blister pack to ensure there are no extra pills that have been added in error. Administering medications outside the 1-hour window. If a medication is not administered within an hour of administration time, the pharmacy is to be contacted and instructions followed. If the pharmacy recommends not administering a dosage, staff are to place the medications in the discarded medications vial or storage container. An incident report is to be written anytime medications are administered outside the time range. Circle initials and write a note on the back of the MAR sheet indicating what time medications were administered. Whenever a resident is on a leave of absence, for example, gone on an extended visit with family or a Special Olympics event in which they are required to take medication with them, a medication transfer form must be completed. Staff are to ensure the medication transfer form is filled out when they are preparing the medications. Staff preparing the medications must also advise the incoming staff, if applicable, of the leave of absence via written report in the communication log and verbally when possible. The form must be signed by staff who prepared the medications and the person, family, staff, or Special Olympics team who is receiving the medications. The completed form must be returned with the resident. Person who received the medications must sign to indicate that all medications have been administered. Here is an example of a medication transfer form. All medications are listed on the first form, the name and instructions and time of administration, as well as the total number of pills. The first form is signed by staff preparing the medications and the person receiving the medications to verify exact medications handed over to family or Special Olympics staff. The second form is to be completed by them while the resident is away to ensure all medications were given and at the correct times.
Guidelines for medication use. Never use medications from an unmarked container or box. All medications must have a pharmacy label. Never use from a container with a label that is difficult to read, not even if you think you can identify the medication. Never use medications that have become cloudy or have changed in color. Never use medications that have sediment at the bottom of the container unless the medication normally requires shaking before use. Never use medications prescribed for another resident, even if you are sure it is the same as the one prescribed for your resident. Never return a medication to a container after it has been prepared and not administered. Discard the medication. Never transfer a medication from one container to another. Never give medication that has expired. And never call pill medications candy, even when it has a pleasant taste.
This concludes the Medication Administration Refresher Training for Module 4. You will be required to complete a test at the end of this slideshow. This can be located on ShareVision in the training section.